Well, welcome to Age Friendly, and here we are into fall and nearly into winter, and this is a time when you say to yourself, what kind of vaccination should I have? Where do I even go for a vaccination? And there's all kinds of mixed messages out there about vaccinations. I'm Rebecca Johnson, and our program today is about vaccinations, needless to say, and I'm joined by Laura Dennis, who is the manager of Vaccine Preventable Diseases Program with the Thunder Bay District Health Unit. I had to look that up to make sure that I had that all right, Laura. We are very pleased to have you here today. This is a program that really will inform the community about what kind of vaccinations, and as we get older, how does a vaccination fit into healthy aging?
Great question, Rebecca. So as we get older, our immune system, which is our body's natural defense to infections that we encounter and different bacteria, it starts to become less optimal, as many other things with our bodies as we age. And so older adults are more prone to have serious complications against infections that they get, such as flu, RSV, COVID-19. And so when our immune system is not working optimally, we could have more serious complications, which in older adults could lead to frailty or increased frailty, and decreased mobility, and the lack of ability to live independently, let's say, could be affected by infections. So we probably all know someone, a friend or a family member, who was hospitalized with a serious infection, and they recovered. We thought maybe they wouldn't. They recovered, and their independence was affected, and their mobility maybe, or their independence, and they just were never the same after that infection, and maybe needed care more often, and maybe were less able to live independently at home.
Right. And certainly today, in today's environment, in the news, there's pros and cons to vaccinations. But the health unit, which we should be looking on because it's science-based, is definitely recommending that we have them. But you can get infections and all kinds of serious diseases if you don't have vaccinations.
Yes, yeah, that's very true. So it is very important for older adults to stay up to date with their vaccinations. Just like we talked about how vaccinations can really play a role in supporting a healthy living and a healthy lifestyle for older adults. There's all sorts of messages for adults around healthy aging, eating healthy, exercise, and I think vaccines are just one more of those things that play a really important role in supporting adults in aging and living healthy, independent lives.
When we talk about the fact that we want everybody to have a vaccination, I mean, that would be the ideal, and hopefully that people that are listening to our program today recognize that. Is it important to have, like, everybody having vaccinations, or how do we deal with that situation?
Yeah, and so some people can't get vaccines. So, for example, very young children or babies may be too young to receive a vaccine. A lot of vaccines are only available or licensed for those who are 6 months and older. And some people may have serious medical conditions, immunocompromising conditions, where their immune system is weakened and they aren't able to receive vaccines, or when they do receive vaccines, they don't have that immune response that somebody with a healthy immune system may have. And so for those people who can't receive vaccines, it's very important that those around them are protected. And have you ever heard of herd immunity, that term?
I have, yes, but go ahead and explain that to us.
Yeah, so what herd immunity means is that it's the idea that by protecting ourselves, we're also protecting others. And so with herd immunity, if there is out of a group of people, and so this could be somebody's close-knit group, your bubble that they said in COVID. So if people within that group are protected and one person isn't, it's less likely that an infection could spread to that person who isn't protected, because those around them are protected, making it more challenging for a virus or an infection to spread from person to person.
So it's really important that we all go about doing this. And the health unit, and we're going to be talking about that in one of our segments today, about where you can go and get a vaccination and the importance of doing it. Could I just ask you a question about coming out of COVID? Because it's a little bit out of context for what we're doing, but it just comes to mind for me is the fact that during COVID, there was a definite push to have vaccinations. It was huge, and now people are saying, I've had enough COVID shots, I'm not doing anymore. Where should we be on that whole spectrum of COVID shots?
Yeah, that's a great question. Yeah, and during COVID, there was a lot of information out there, and a lot of information was changing rapidly. And there was a push to receive vaccines, and there's lots of messaging about it. And now that we're out of the height of the pandemic, it's still very important for older adults to protect themselves, but there's less push, there's less promotion about it, maybe less awareness too.
Right.
And COVID-19 is one of the many infections that as public health practitioners we're concerned about and we want people to be protected against. It's just one of the many. There are other infections that are increasing in our community in Thunder Bay, and it could be a result of less awareness and less people going out and getting those routine immunizations, the ones that we normally would get when we turn 65 because they're free and recommended in Ontario. Because during COVID it was really focused on getting your COVID vaccines, and less information was available about the other routine immunizations, and there may have been less access to those vaccines at the time too.
I'm going to pick up on something you just said about free, that do people understand that they're paying for it through taxes and other things through government, but you can go into wherever to get the actual vaccination, and it's not going to cost you anything. That's important.
Yeah. Yes, so the province of Ontario covers many vaccines for older adults, and they are free of charge, and so that's really, really, really great for the healthcare system and for older adults who can benefit from these vaccines.
Well, that's not an excuse then. To me, it's, I mean, people should, to my way of thinking, I'm very biased in this area, because if it's going to help you as in your own health as an older adult, I want to have something that will, whatever I can do to make that happen. And knowing that it's free, that's a real asset for the program that you provide for us.
I agree. Yeah, and I think not only that, but it's the awareness and the access that play a big part as well, and the motivation to do it. And there's a lot of misinformation out there that a lot of information out there about science and about vaccines, and so that there are a lot of factors, but for the free vaccines is definitely a motivator, as well as we as a health unit, we try to provide equitable access within our community, and we often tend to hold clinics just to fill those gaps. Yeah. So if there is a certain population or group of people that may have less access than others, we try to hold clinics just for them to increase that access.
We'll conclude on that for now. Here we are with Age Friendly, and we're talking to Laura Dennis, who's the manager of Vaccine Preventable Diseases, the program at the health unit, and we're talking really about vaccinations, how very important it is, and what kind of eligibility and access do we have. So, Laura, let's start off with that. If you want a vaccination, what kind of vaccinations are they, and how eligible do you have to be to get them? Yeah. That's a long question, but anyway, let's go from there.
Yeah, so part of the health unit's goal, and especially post-pandemic, as we were talking about, is to really raise awareness to adults and older adults on which vaccines are available to them for free and which ones are very highly recommended for them to receive. So before I talk about some of the respiratory vaccines that we're going to get to, because it's the fall season and
Correct.
we definitely want to talk about those, I want to talk about the tetanus booster. So tetanus diphtheria vaccine is a vaccine that is recommended to adults every 10 years. It is a vaccine that we get as children, and throughout our lifetime, it's recommended every 10 years to get a booster. And regardless of when your last tetanus diphtheria booster was, it is recommended to receive a tetanus diphtheria pertussis vaccine. So that includes the pertussis portion, which is whooping cough. You might have heard of whooping cough.
Yeah.
And so whooping cough can be very serious in young children. It can lead to hospitalization and complications, closing of the airways in young children and infants when their lungs aren't fully developed. And so this is a really important vaccine for older adults to get, especially if they have grandchildren or great-grandchildren and they're going to be in contact with young children.
Right.
Yeah.
One of the things that my doctor recommended, because I have asthma and I'm having problems even right now with breathing, but the point being is the pneumonia one and that's like a one-time shot that I have to have, and I've done that.
Yes, pneumonia is very important to the pneumonia vaccine, and so I did bring some slides, and I do have some data to share.
Okay,
so,
and they're going to put those up. We won't worry about that. But you've got an idea of yes,
yeah.
So we can figure this out.
So according to the latest Canadian Health Survey, for seniors, the current vaccination rates are lower than we would hope. So the goal in Canada is that 80% of older adults are vaccinated, and we talked about herd immunity and the benefits of older adults being vaccinated. And as of 2022, only 51% of older adults over the age of 65 reported being vaccinated.
That's not good.
Yeah, and so this is a concern because you mentioned pneumonia, and in Thunder Bay area, we have seen a rise in pneumonia cases recently in 2025, and 22% of all the Thunder Bay District Health Unit cases that were diagnosed with pneumonia were 65 years of age and older. So that's a high portion that were older adults. And of these local cases, 92% of the local cases were sick, who were sick, that were with a strain that was vaccine preventable. So it was a strain that could have been prevented by receiving the vaccine or being up to date on immunizations. And of these cases in Thunder Bay, 70% of these older adults, or of all cases, were hospitalized.
That's a high number.
Yes, it is.
So our second slide, then we'll put that up.
Yeah, so the second slide highlights that during the we'll talk more about, so pneumonia is a respiratory virus, so it does peak during the respiratory season, but the vaccine that protects against pneumonia is available year-round. So we don't promote it. It's not a one-time vaccine, only in the fall, like flu. It is a vaccine that is recommended for older adults when they turn 65 and would be recommended for children or adults if they have serious medical conditions or chronic medical conditions even, or certain risk factors that put them at a high risk. And so that's a really important vaccine. And then some of the other respiratory vaccines, such as COVID-19 as well as flu, are really important for seniors or any older adults to receive as well. So just some local data that I have on the next slide. We had at one time in our hospital here, we had 20 seniors in hospital with COVID-19 and 25 in hospital with RSV and 25 in hospital with flu. So it's interesting data. It
makes you stop and really think about maybe there's a better way of doing this is by getting a vaccination kind of a thing.
Yeah, and that upstream thinking,
Right.
that and taking prevention seriously. Yeah.
We should do that. One of the things that people will say maybe is with the flu vaccination, for example, that why should I bother because I'm still going to get flu? My retort is that, well, I could maybe still get flu, but I won't get it as bad.
Yeah.
Has that got some sense to it, or is that
Yes.
just my thinking?
Yes, absolutely. So there are certain vaccines, such as COVID and flu, that doesn't completely prevent the spread of infections.
Yeah.
But what it does is it will support your body's response to those infections should they encounter them, and it will reduce, and it has been, there is evidence proving that the vaccination will reduce the complications or the severity of symptoms when somebody
That's what I'm trying to
is
get at.
exposed.
Thank you for that reinforcement of my comment. The third slide that you have for this time.
So the third slide. So this is national data, and just again highlighting how very serious some complications can be in older adults. 92% of all COVID-19 deaths in Canada were people 60 years of age and older. This is 2024 data. And then flu and pneumonia, 90% of deaths from flu and pneumonia across Canada occur in those 65 years of age and older, over half of them being 85 years of age and older, and that's 2022 data. And so what you can see is the older that someone is, the more likely it is that they have severe complications, hospitalization from infections such as COVID. And
if some of those people then had vaccinations, would those stats change?
Yes, absolutely. Yes, we do. Yeah, vaccines work very well, and so it is. The data doesn't show who's been vaccinated and who's been not, who's not vaccinated, but there is evidence showing that. So, for example, the RSV vaccine is new this year, so I want to highlight that. So it's been around for a few years for older adults, and so those who are in long-term care homes have been eligible for a few years, and then those who have chronic illnesses and complications with their health have been eligible. And this year, anybody over the age of 75 is eligible for the RSV vaccine. And so data is suggesting when we have new vaccines, the number of complications and hospitalizations in groups who are eligible for those vaccines is decreased significantly. And so we can see that year after year in Ontario as we have new campaigns for publicly funded vaccines.
So you can definitely see a difference in that. Laura, we'll come back and talking about very quickly and with our third segment of our program today about the vaccine effectiveness and safety factor of that, and so stay tuned. Well, welcome back to Age Friendly, and Laura Dennis is my guest, and we're talking about vaccinations. Now, we've talked about safety and a few other things, which I'd like to get into a little bit more, Laura, but first off, let's talk about where you go get a vaccination. It's vaccination time, fall primarily, and when you can go. So how do we do that?
Yeah, so great question. So routine immunizations, so we talked about the pneumonia vaccine, the RSV vaccine, the tetanus vaccine. Those are available at your healthcare provider. So family doctor, nurse practitioner, whoever you see. For those without a healthcare provider, we have a clinic at the health unit. And so we have a weekly clinic, and people can come to our clinic. We have online appointment booking, but also you can call to receive an appointment.
I'm going to interject. Can you get some of those shots at the pharmacies and things as well?
Yeah, that's coming. So, yeah, so the pharmacies play a really big role with COVID and flu vaccines.
All right.
And there are some other vaccines available at pharmacies, but they aren't the ones that you can get for free. So
right.
if you are eligible for a vaccine for free, I would recommend either the health unit or your family doctor. And then during the fall and in the spring, pharmacies play a big role in offering COVID-19 and flu vaccines. So most pharmacies in Thunder Bay, if not all of them, are providing these vaccines.
Right.
And then the health unit is also having some clinics. Not all family doctors provide COVID-19 vaccines. Most of them provide flu and RSV, but not all provide COVID-19 vaccines. And so recognizing that, to increase access this fall, the health unit is hosting some clinics, and online booking is available for those
Very
clinics.
important, though. I mean, you can access them in various ways in the community. That's the most important. So it's up to individuals to search that out. But even if, and many, unfortunately, older adults have to get medication, so they can contact their pharmacist at that point in time as well.
Yeah.
One of the things I'm interested in, though, Laura, is the fact that effectiveness. Are really vaccination? I think they are. But anyway, the point being, are they? Can you show that to us? I know you have a slide, and we're going to put it up.
Yeah.
What used to be and what it is now because of vaccinations.
Yeah, so my slide highlights, it's actually not my slide, it's from the Public Health Agency of Canada.
Okay.
And it highlights the rates of certain infections before the vaccines were available for those infections. And then between 2016 and 2020, so quite recently, what the rates are. And so it shows a really big decline in the rates of these infections after vaccines became available. And we talk to older adults who come to our clinics who, they remember having grandparents or parents who only had one leg because they had polio as a kid, and they remember the influenza year where many people that they knew passed away from influenza, and so yes,
there is a difference.
There is a big difference. Yes.
So here's this whole herd immunity situation that we talked about earlier, is the fact that if everybody did this, we could maybe eradicate some of these diseases, seriously.
Yes, and we have. Yes, and we have. Measles was eradicated prior to recently.
Right.
In North America, and so with less people being vaccinated over the last 10 years, we've seen cases of measles popping up, and we've actually seen outbreaks in Canada and in Ontario this year.
We shouldn't have that. We shouldn't go backwards, I don't think, anyway. No. When we talk about the whole landscape after COVID, because there was a lot of hesitation, and now there is, as I said earlier, the fact that some people are saying, I had enough COVID shots, I'm not having any more. Where are we with that whole area of the landscape for everything?
Yeah, so, and even before COVID-19, there was a changing landscape, and I think the pandemic kind of changed it. Yeah, changed it. Yeah. And so, I think part of a big factor is that during the pandemic, and just the way that people receive their information now is a lot of it is online, and social media plays a really big role in people receiving information from social media. And there's just so much information to decipher. And so it becomes really challenging. And I think it's really hard for people to navigate and to figure out what information is factual, what information isn't. And so I think it's really important for public health professionals who are concerned about a decline in vaccination rates, and though it's really important to get out there and to talk about this and to create a safe space for people who have questions, and a non-judgmental space. And that's what the health unit here tries to do. And I know Northwestern Ontario Health Unit also tries to do the same thing. We have nurses on who are experts in vaccines.
Right.
I mean, they're really knowledgeable, and we have somebody taking phone calls every day just to address public questions.
Right.
I think it's really important too for older adults to speak up and talk to their family members about their personal stories. And, you know, if they knew people who suffered from a vaccine preventable illness, those personal stories are really powerful, and I think that it really changes the risk perception for people when they hear personal stories.
Right. I know I checked out your website before we did our taping earlier, and there's a lot of information on the website for the health unit about vaccinations, which is really of value. But many people unfortunately don't have a computer and don't go on that. But that is available if you were able to access that.
Yes. Our website has a lot of information, but we're also available if people want to call. Other great websites, Public Health Ontario has a vaccine safety website.
Right, okay.
And so does Health Canada, which explains, vaccines undergo very rigorous studies. And safety checks. It's the medication that undergoes the most safety surveillance.
That's a good thing.
Yes.
Laura, I have to conclude. Laura Dennis is our guest today, and we're talking about of course, vaccinations. Make sure that you have your vaccinations up to date, and you can get that information at the Public Health Unit. And we just finishing off our program today, and of course, you've got to keep in shape. So make sure that you join us with Linda DePiro, who will give you your 1 moment of exercise. And that'll start right now.
Hi, I'm Linda DePiro. Today I'm going to show you a seated chair sequence that works the pelvic floor and aligns the pelvis. So we're going to first find the sits bones. I'm going to stand. Now when you hinge forward with a straight back, you're going to feel these nice little bones, these kind of protruding bones out. Those are your sits bones. So let's sit down and just to find those sits bones upright. We're going to do a few little exercises. We're going to hinge back and forward, and we're going to hinge forward and back. So nice little hinge back, upright on the sits bones, forward and back. And I want you to kind of tuck under, so we're rolling back of the sits bones and rolling forward. So rolling back, rolling forward, again rolling back. So you want to do more reps. I'm just going through them quickly, and then shifting. So shifting your weight from one sits bone to the other, right? Then we're going to lift a little higher, and it's like you have a little brush underneath. So the hip comes off a little higher so that you can actually brush, 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 brush. From here, let's bring the knee forward and the pelvis back, working sagittally on the chair, right? Ready to do our little inchworm. So from the back of the chair, walk up with your sits bones all the way to the edge, and then walking back. So do that 5 or 6 times. I have a rolled up towel here for the next part. Place it just in front of the sits bones. And from here, we're going to roll back and roll forward. So kind of rolling, feeling a different texture, and working that pelvic floor a little bit more. Sitting upright, circle the arms, the pelvis can move, and then you can keep the pelvis also still. So coming off, you have a very well organized pelvis. We can do a little side bend and a little bit. So there you go, well organized, and you worked your pelvic floor, and your alignment will feel very, very good. See you next time.